My name is Eloma Hadime, a midwife. I am also the Vice President and co-founder of Ask A Midwife Ghana. Ask A Midwife Ghana is an organization made up of experienced and professional midwives. Just like the name says, Ask A Midwife Ghana. Ask A Midwife Ghana is situated in all the regions in Ghana. Our midwives are on standby on all social media platforms to answer your queries pertaining to maternal and child health care, issues in pregnancy, preconception care, postnatal, how to handle your issues pertaining to labor signs. Our mission is to promote sexual and reproductive health rights in achieving women empowerment. Our vision is to empower all women and our growing girls to take decisions about their reproductive health rights. COVID is here with us. I would like to entreat all out there, especially our women and our pregnant women, to take very good care of themselves, continue to adhere to the precautionary measures announced by the World Health Bodies and the President of Ghana to ensure that we all live happily. Thank you.
Hello, my name is Esther Hannah Kwao, and I am the Communications and Missions Engagement Personnel for Ask A Midwife Ghana. Ask A Midwife Ghana is a non-governmental organization that is made up of professional midwives all over the regions of Ghana. We aim at contributing our quota to the reduction of maternal and newborn mortality. We focus on giving education to the public and women of their reproductive health age to be well informed on their reproductive health rights and contraception, and aiding them to make appropriate decisions when it comes to their health. October is the month of Pregnancy and Infant Loss Awareness Month. Hence, the need for us to educate our women on some of the causes and prevention of pregnancy and infant loss. According to the Maternal Health Survey in the year 2017, 67% of pregnancies among women of their reproductive age, that is the age of 15 to 49 years, ended up in live birth. 2% resulted in stillbirths and 12% miscarriage. 10% also resulted in induced abortion. We have realized that some women lose their pregnancy in the early stages of their pregnant life. That is from the first week to the 20th week of pregnancy, and others from the 20th week and beyond. When a pregnancy is terminated from the 20th week of pregnancy, before or up to the 20th week of pregnancy, it is termed as abortion. And when it is beyond the 20th week of pregnancy, we termed it as stillbirth. More than 80% of abortions happen within the first 3 months. So now we'll look at some of the causes of stillbirth. I'll group them, the cause according to the mother and then the cause according to the fetus. Some of the causes come from the mother and some come from the developing baby. So let us look at some of the causes that are really associated with the mother. When a mother has problem with her womb, that is the shape of the womb and the type of womb that the woman is having, or when the cervix is the neck of the uterus or the womb that holds enclosed to make the pregnancy to stand firmly. When there is a problem with it and then it is not really tightly closed, this pregnancy can come out. We can also have pregnancy or labor complications, which usually account for 1 in every three stillbirth loss. So for that one too, pregnancy complications such as maybe a woman having bleeding while she's pregnant, having anemia, or labor, when the labor is really prolonged, the number of hours that we expect the baby to come, it doesn't happen like that. It prolongs the labor. The blood supply that has to go to the baby reduced. Maybe how the labor was managed, it can also contribute to the loss of the baby. We also have maternal infections such as malaria, gonorrhea, syphilis, HIV, sexually transmitted infections in the mother can cause or contribute to the loss of pregnancy. When the mother has a maternal condition such as uncontrolled diabetes or hypertension during pregnancy, sickle cell condition, it can predispose this mother to lose the baby. We also have maternal lifestyle. The way a mother carries herself about, taking in of alcohol, smoking while pregnant, taking in of medication by herself, self-medication in the home, predisposes these women to also lose their pregnancy. And then exposure to radiation, the X-rays, radiations, heavy radiations that come from heavy machineries, it causes this pregnancy to also, these women to also lose their pregnancy. We can also have lead. If lead gets into a woman's water or even to the body, it can contribute to the loss of her pregnancy. We also have instances where a woman carries twins, let's say 2 or more, because of the expansion and the weight on the uterus, the pregnancy tends to abort. We also have resource incompatibility. That is the blood grouping of the mother needs to be identified or known while the woman is pregnant. There are resource factors that we look at. If a mother is a resource negative mother and the baby is a resource positive baby, the father is also a positive father. Resource negative does not usually affect the first pregnancy, but the subsequent one. When a woman delivers the first child and she is resource negative, she needs to be given an injection that will protect her body and sensitize it from the subsequent pregnancy from being aborted or miscarried. This will aid the woman to continue to carry all the other pregnancy and reduce stillbirth and neonatal loss. Other causes that was identified was that women who usually experience financial and emotional stress before or during the year while the woman was pregnant, they have increased chances of stillbirth. Therefore, when a woman is really pregnant, she needs to be financially sound and emotionally sound so that she can carry her pregnancy to term and then deliver peacefully. Now let's look at some of the fetal causes. We have separation of the placenta, that is premature separation of the placenta when the time is not due and then the placenta begins to detach itself from the maternal wall. It causes the baby to be aborted or terminated or even die whilst in the mother's womb. This is because the baby receives its nutrients and supply from the placenta. The nutrients that will aid it to really mature by day. So when there is a separation, then it means that the baby is now being deprived of its supply. We have birth defects. Birth defect usually occurs in every stillbirth fetus that has a structural defect. We also have infection of the bag of water, that is the liquor or the fluid that protects the baby whilst it is inside of its mother. When there is any infection that goes there, it really affects the baby. Now let us look at the prevention. With the prevention, we have what we call preconception care. Preconception care is the care that is given to a woman or couples who intend to get pregnant. and it's usually done before 3 months to a year before they now decide to get pregnant. They are taken through lots of labs, education to identify any problem where they need to be given assistance. They are given. When a woman is really informed about her reproductive health, it aids her to take part of her care and then to prevent adverse outcomes. We also have initiation of early antenatal clinic or care. Mostly our women decide that we want to stay home for some time, maybe like a period of 3 to 6 months before we will now show up at the antenatal. It is very important that when you know that you are pregnant, you report early so that we can take you through all the necessary education and the labs and then start the antenatal. And the antenatal visit should not be less than at least 4 times. You have to visit the antenatal clinic for not less than 4 times. You must also ensure that if you have a medical condition such as hypertension or diabetes, it is under control before you get pregnant or even whilst you are pregnant. You have to take your care very seriously and you need to be given a special care. So if you are in having such a medical condition, your care should be different from somebody who is not having any medical condition. You also have to take your medications very seriously. Most of our women don't even take the hematinics that we give them to go home to take, most especially the folic acid. You need to take them seriously and you must avoid self-medication, buying drugs from drugstores or pharmacies or taking even herbs that are not really prescribed or that the hospital doesn't have any idea about. We have to avoid all those things so that it will safeguard ourselves and then the pregnancy. You also have to report all signs of danger to the pregnancy, such as whilst you know you are pregnant and then you are bleeding, you are having persistent vomiting, you are having fever or very high temperature, when you are having severe headache, when you know that you are becoming so stressed up, tired easily, and then anything that you think you don't understand, you have to really report, like convulsion, anything that you think is not really understandable or you think is different from the normal you or the normal pregnancy you that you know, you have to report. You must also ensure that your routine antenatal lab and scans are really done and then well documented in your book for continuity of care. And then you also have to ensure that you are eating well, adequate and balanced diet. You have to talk to your midwife in case you don't know what to eat. I think that mostly we give education to our women at the antenatal, and you are at liberty to discuss anything with them. Adding up fruits and vegetables to your food. Talking to your midwife will help you to understand it. So this is where we'll bring our discussion to. I will continue with preconception care the next time in my presentation. You can drop your questions and comments on our Facebook page, Ask A Midwife GH. Same for Twitter and Instagram. And all the questions and then the things that you don't understand pertaining to your reproductive health education shall be answered. We provide antenatal services, labor and postnatal care to women who are pregnant and who have also delivered. You can contact us on 0246 466917. The number again, 0246 466917, and you will be connected to a midwife in your own region or locality. You can always rely on Ask A Midwife Ghana. For your reproductive health education, you can follow us on Instagram, Twitter, and on Facebook